You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back to the show, Health Innovators. On today's episode, I'm sitting down with Harsh Vathsangam, who is the co-founder of Moving Analytics. Welcome to the show, Harsh.
Good morning, Dr. Roxy. It's a pleasure to meet you and excited to have this conversation and just discuss all things healthcare.
Yes, absolutely. So you have such an interesting background. Let's start off by just telling our audience a little bit about what you've been innovating these days and kind of your background, what led you to where you are today.
Sure, absolutely. So a little fun fact about me, I've lived and worked in 4 countries. So I've in the Middle East, in India, in Australia, and in the United States. So, I've just been...
True globalization.
Yes, exactly. Yeah. I got the chance to experience a whole variety of cultures and just societies. And I think it's made me a better person for sure. But closer to my professional life, I did my PhD in computer science at the University of Southern California. Originally started there thinking I would do a robotics PhD and more work in hard sciences and so on. But through a combination of fate and interest, I think I ended up in healthcare. And I would say a lot of my work has been in how data science can be leveraged to deliver better healthcare. Initially did a lot of work in basically creating models of the human body as related to how, when you exercise, how do you burn calories and so on. Mm-hmm. Then started getting into essentially prevention and how we could change day-to-day behaviors based on data that we sense about you. And that was what eventually led to Moving Analytics and the work we do in cardiovascular care. So that's a little bit quick background, but obviously happy to dig deeper there. Yeah.
So tell us a little bit about Moving Analytics and when you started the company.
Sure. So depending on how you define starting, we started in 2013. So the thesis behind Moving Analytics is that cardiovascular disease is the number one cause of death and the number one source of direct and indirect healthcare costs today. A lot of that is borne by health plans, but more and more is being borne by individuals themselves as we shift to the more high deductible health plans and so on. But the silver lining is that a large part of it is preventable if you can change day-to-day behaviors. And those are things like getting people to exercise more, eat better, take their meds, and so on. But as we know, there's a lot of slip between the cup and the lip, right? Like in the sense that you can say you need to exercise more, but there are so many personal, societal or environmental barriers that can make a person not exercise. And so we really think that there's this space for creating evidence-based therapies to really help people to identify and then surmount those barriers from a behavioral perspective. And that leads to better cardiovascular outcomes and better heart health and so on. Yeah.
I'm just curious, we've had behavioral science kind of integrated into healthcare for quite some time now. Just in the work that I'm doing, done in the past with just communications for different types of clinical programs where you're kind of segmenting that messaging strategy on different segments of the population to kind of motivate them in different ways. So how is what you're doing different that's really going to drive results?
Yeah, so I think it's a combination of things, right? So behavior change doesn't happen in a vacuum. Right. It's sometimes you need almost like a life-altering event that happens for you to decide, hey, this is the time for me to change my behaviors. So I this life-altering event doesn't happen to me again. And that basically what led us to start our first product in this space, which is in this area of cardiac rehab, which happens after an acute event, like if you had a heart attack or heart surgery. And then we take you through a behavior change program that really helps you to improve your heart health in a way that you don't get a second heart attack. The reason why we picked that and why that's important from a behavior perspective is you literally had a life and death event. And if a few seconds here and there, it could mean the difference between you being alive or not, right? And
if you're not motivated now, you probably never will be, right?
Yeah, exactly. And that's actually a really great point for behavior change. And a lot of what we try to do is to try to get the patient at the bedside, even before they leave the hospital, to say, and we capture them in that moment. It can be a very confusing time. A lot of patients have anxiety and depression at that time period. Yeah. But we essentially try to work with them to say, hey, this is not the end. This is actually a new beginning for you. And we would like to work with you to make sure that this doesn't happen again, or you can get even healthier than you were before, so it doesn't happen again. And from that point on, it's all about personalization. It's about convenience. So trying to meet the patients where they are, and also trying to, rather than us dictating to them, hey, this is what you have to do, we try to lead with empathy, right? And essentially say, what is your life like? What are your hopes? What are your aspirations? What do you see as barriers to yourself? And what do you want to change about yourself? And then we start from there to build a program that makes the most sense for them. So, and so it's those two things that I think are super important as well.
So let's kind of dive deep into your journey. I love when you were saying earlier about it depends on when you count on when we start, we started, right? So kind of just go back to 2013 and what were some of those things that you were encountering where you were maybe like start, stop, and just kind of give us some snapshots of the earlier days and what that journey looked like for you.
Sure. Yeah. A very insightful question. So I think to start with myself, personally for me, I did my PhD and I worked at Microsoft, and then I also did a postdoc at USC. What became apparent to me was I really enjoyed building technologies, didn't really want to optimize my life around an academic life, which is, publications, grants, and so on. So I wanted to work in technology and create new technologies, but not necessarily optimize for the publication, other aspects of it. So I feel just as a person, I was the kind of person who liked to do startups. And I think that was just something that I wanted to do. I was passionate about. And if not this, I would have probably ended up in a different startup as well. So I think that
change the world, right?
Yeah, exactly. And now, with respect to that, one of the things I think a lot of entrepreneurs get enamored with is the technology that they build, and not necessarily the application or the benefit that they provide. So I was very lucky in that I had a very supportive PhD advisor, Dr. Gaurav Sukhatme, who's sort of an early investor in the company too. He encouraged me to do two things. So one is, if you want to start a company, stop taking classes, just go start the company and learn. So get out in the wild and do it. But he was also really supportive to me in terms of finding opportunities to get some coaching. And so we had this opportunity to participate in this program called the NSF iCore program, which is an interactive program where they encourage you to, quote unquote, get out of the building and talk to customers. So I think we had this tremendous, basically 2013 and eventually 2014, we got paid a little money by the government to essentially, through a grant, to essentially go out and talk to customers and build theses, right? And
that's huge. That's a great footing and foundation to start on.
Yeah, exactly. And what we've learned through that, so number one, it's super hard to go out and talk to customers. It can be scary, but you have to do it. And the more you do it, the better off you'll be. Number two, we learned essentially we were basically a technology looking for a solution rather than trying to find a true need in the market that needed to be solved. And then seeing if we can leverage our expertise to solve that problem, right? So starting with the needs of a potential customer and then trying to use your knowledge to resolve it, rather than saying, I have this technology, would you want it?
Is that hard for you? As somebody that wants to build something, I mean, was it just natural for you to start off with the problem solution? Okay, this is what we can build. Or was it kind of this, internal struggle of this is what I want to build, but there's nobody to buy this?
I think there was certainly a struggle, and we had to change our mindset a lot to say, put away your expertise, put away your what you want to do. And really try to understand and try to empathize with what people are going through and see if there's a solution there. And there's multiple levels to that. So there's do people have a problem? Do they realize they have a problem? Is their solution really the right solution, or is it a different solution that you could come up with, especially coming in as an outsider into their world, right? So so I think those are all more subtleties we picked up as we got better.
And the consequences of those decisions are like game changers on whether you're going to have commercial success. If we kind of go back to what you were saying earlier about, your mindset or goal of kind of integrating behavioral science in with this technology, if you would have chosen a different therapeutic category, that you might not have had as much success. If you would have chosen a different point within that care continuum, you might not have had so much success. And so many times, I don't think that innovators are doing that type of thorough analysis to really, especially when you can build a solution that can help many people at many different stages. And I don't think enough people spend the time upfront doing all of that analysis to really be able to get to, you've had a really terrible cardiac event. It becomes the trigger that creates the sweet spot for your solution. Great.
That's absolutely true. In fact, a lot of times from investors, we get asked this question. So you were incorporated in 2013, but you didn't get us why is your revenue not fast enough? And you have to explain to them that 2013 to 2016 was us just trying to understand what the problem was. And in us investing in the long-term benefit of the company rather than trying to find, pushing something and then trying to get some revenue, but then not really building. I think
two customers, right?
Yeah, exactly. And I think it was even more important for us because, although I had a very interdisciplinary PhD working with the Department of Preventive Medicine and School of Medicine, I was still an outsider. I was a technologist, and I needed to break into the world of medicine and really do my time there for people to respect me, for me to learn the terminologies, for me to even simple, like there are just this lingo that everybody uses.
Acronyms everywhere.
Yeah, exactly. And also to sort of flip the other side, like to bring that outsider's perspective, I had to know what the insiders are thinking, so that I could bring so that I could then flip from my left brain to my right brain or whatever it is, and then bring that outsider's perspective. So I think I would highly recommend that spending just without any agenda, spending time in the industry you want to sort of operate in, and try to get really well versed in that. And I think that pays off in the long term too. And I think the best entrepreneurs do that really seamlessly and really thoroughly in the beginning as well.
So what's the secret to sustainability when your first 3 years you're not even like seeking revenue, you're not selling anything, you haven't maybe built anything to sell? What is how are you building a sustainable company that way? And what's it like having those conversations with investors? Like, were you trying to raise money within those first 3 years and really struggling with the investors not understanding that you were still doing customer discovery and kind of like what you had indicated? Or, were you doing pitch competitions and grants and other things to kind of create that sustainability so that way you weren't even facing that situation?
That's a great point. So I'll just kind of put a little personal tidbit. So 2013 was a very momentous year for me because within a space of 30 days, I graduated from my PhD, I defended my thesis, I incorporated the company, and then I got married. So all three happened within 45 days of each other, I think. So
and you survived.
And I survived. Yeah. So, well, I think in that sense, I'm very lucky that my family and my spouse in particular, and my spouse's family were extremely supportive in what was a high risk, and you didn't even know what you're doing at that point, and so I think
we believe in you, son-in-law. We believe in you.
Yeah. So I think that matters a lot when, I guess the point is that they believe in the person and not necessarily the solution or the idea. And they believe that the person will figure it out, and they're supportive no matter what the outcome is, positive, negative, and so on, right? So that's there. And that makes a huge difference when you're out, because you know that, hey, I have people supporting me. So that's number one. Number two, I think, is finding the right team members who are equally bought into that idea. So, I'm very lucky in that around the time that I was starting the company, I had two co-founders who were willing to take that jump with me, whom I met in grad school. And I think what they've told me multiple times has been, the reason we started working with you is because we knew you were serious about this. And that seriousness meant that we could be serious about what we are doing and work with you as well. So I think that finding those team members who also complemented my skills. So I was obviously more technical and more, I'm all about data science, data, all that stuff. Whereas others were more focused on business, focused more on just actually building things and designing and so on. And I think that has carried through the entire lifetime of our company. I think everyone now, we're several we're almost 40 people now, and I think they're all at some level bought into the mission of the company, right? And that's why they're doing this versus the 1,000 other things they could be doing in their day-to-day life. So that's number one. Number two, I think in terms of a more tangible finance perspective, a lot of it was just hacking to get their funds and finding ways to support ourselves while we were evaluating process. We were not ready for any kind of even angel funds at that point. So I think what we tried to do is, we all had day jobs. We worked. I was still doing my postdoc. I was doing my research there, making sure I kept getting publications out so that I would still keep my job and not do other things. My other two co-founders had similar equivalent versions of that. But we worked two jobs. So in the morning, we would work on our regular jobs. The evenings and afternoons, we would work on our company and try to develop things more. Essentially we would all meet in a coffee shop. That was our office, and just sit all across the table and work on things together, and then come back the next day. And we just participate in business plan competitions. We were very lucky in that by being part of the USC network, we were able to get access to foundation money, grant money. I think we raised at least $250,000 through grant money. And I would actually have to thank USC for that ecosystem support in the early days when it's a very fragile business and fragile state of our business. So I think all of that really helps. But I think at the same time, we did hustle a lot. I would just put in a business plan competition application every week and see what we would get. And we'd raise $10K here, $20K there, and then just kind of survive there. So, and then it ultimately culminated in us raising our seed round in 2016 when we got our first customer, and we got our first $25,000 a year contract basically from a customer, and then just we're going from there on in. So I think the lesson that for me personally is, work, just try to find any source of capital you can to fund it, whether it's, getting a day job, whether it is getting that, because, and find people who really believe in you, because at that stage, it's really about that mission and dedication. And especially when the idea itself is just an idea in your head. It's not actually something that's out there in the marketplace. So,
you need someone that's crazy enough to believe this idea that's intangible.
Yeah. And it's, in hindsight, it's been crazy to me how you really have to have that vision that this is the way the world is going to be 10 years from now, and have that conviction that that's how it's going to be. And not everybody's going to believe you, but it matters that you believe in it and you work towards it. And sometimes there's a timing issue. Maybe it's actually 20 years ahead and not 10 years ahead, and so you have to come back to it later. But I think that was what we were talking about. A lot of people back then were like, this doesn't even make sense. Telehealth, what are you doing?
Right. I mean, it just kind of rolls off the tongue now in 2021. Yeah. Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit. Let's just talk about some of those accomplishments that you've had, right? So you've raised, correct me if I'm wrong here, but you've raised nearly 10 million in funding. You've got over 1 million users on the platform. And you also have some really big marquee customers like Mayo Clinic and Kaiser and Highmark. That's a really great contrast from the 2013 story.
Yeah.
It's got to feel good.
It does feel good. Sometimes it's, when you're climbing up the mountain, you have to stop and see the view and then go up the mountain again. And when we see the view, I think we're really proud of some of the accomplishments we've done. I think there are a couple of things that through those, I think the logos and the fact that those, extremely high profile customers trust us with their business is a huge, it's both humbling, but also inspiring to me. And I really want to make them happy. And I think all of us want to make them happy. I think what I'm particularly proud about is just the number of patients we've served, whose lives we've improved. And as part of that, I think I'm also proud of the team that has joined to force us together to serve them, right? And I think those two things are things that I'm just as a legacy, I'm really glad that I've gone through this experience, and I hope that more people join us as well through this as well.
Well, you never know who's listening. Yeah. So kind of like the in between. Kind of give us the highlights of the in between 2013 and where you are now. What are some of those as you look back? What are some of those winning moves? It may be things that we would expect. It may be things that were unexpected. That when you look back on it, you're like, wow. These moves that we made or these opportunities that came before us were actually ended up being real game changers for us.
So I think in hindsight, I would say 3 to 4 things. Number one is, I think us doing that initial ICOR process, which really made us very customer focused and not technology focused. And that has soaked into our DNA, like at every level of our company. And so to the fact that the motto of our company is empathy guiding expertise. So that is what we try to have everyone follow through. Yeah. Number one is that. Number two, I think, is just our first study that we did with the VA Medical Center, who's still our customer today in Atlanta. And that was the first paper where we were able to show with our technology, we were able to produce really meaningful outcomes for veterans and the work that they do, and make sure that they reduce the risk of cardiovascular disease. So that was a kind of important moment for us. I think was it
difficult landing that first pilot customer?
I think so. Yeah, I think it was hard for us to, as a startup, particularly in healthcare. Evidence is key, right? So you need to show that your technology actually improves lives or improves outcomes in some way. And so really finding that early adopter partner who's willing to trust, again, they're placing their trust in me as a person and the founding team as people to say that this is going to work out well, and just leveraging that. And the VA has been a great partner for us in terms of helping us validate our technology and even support us through our growth as a company. So I think I can't say enough positive things about them as well.
Great.
Yeah. I think the 2 other points would be our first study with like a health plan, which is namely Kaiser, that we started working with, and our first reimbursement that we received as a provider from another health plan, namely Highmark Health. Those have been like really important moments because once once you break that barrier, it's easier for everyone else to start working with you.
Yeah.
And so and I think that's been the case now, where more and more health plans are covering us as a benefit. But I think those are kind of like the sort of landmark things that happen in our journey as a company.
So as you were getting to those landmarks, those milestones, what was that like? Was it really easy? You just picked up the phone, you just called them, and then they immediately said, "Oh my gosh, Harsh, you're so awesome. I love your vision. Yes, let's do it." What was that like? Is there anything in that process that you uncovered that would be something worth sharing with the audience here?
So I have to give credit to my co-founders who, first of all, found some of those deals. And I think, for example, Ade Sanya, my co-founder who leads our business initiatives, the Highmark study came from him just sending a cold email, LinkedIn, to a person there. He was lucky that the person responded, and then that was the hook he got to basically get that going, right? So you never know where that lead is going to come from. So you take your chance always. Like, I think that's. I
think everybody in the audience wants a copy of that email, right? And I'm just.
If someday we'll publish it as a blog article.
Right. Yeah.
I think the other part I would say is really listening, even at that stage, listening to what the customer's priorities are. So, maybe you have priorities, like I want to validate my technology, whatever, but that may be different from the customer's priorities. And you want to either mold your priorities to match theirs, or find the intersection that matches that with their priorities. And I think in Highmark's case, for example, the key was that they wanted to be able to look at their data to see if there really was an opportunity for cost savings in their cardiac populations by working with us. And what we tried to do is to make it as easy as possible for them to run that analysis. So we literally gave them things like CPT codes, ICD-10 codes. We gave them a sample analysis sheet and things like that to make it as easy as possible for them to run that as quickly as possible. And that helped a lot, I think, in terms of Highmark discovering that there was a problem, and that they're willing to take a pilot to validate if we solve a problem. And then the pilot was successful, and things moved on from there. But that it goes back to that, listen to the voice of the customer and what their priorities are before you mold your pitch to match their needs as well.
Yeah, absolutely. And I, obviously there's this consistent theme that you keep coming back to is that customer voice that gets woven into the business. I'm a huge proponent of that being part of the culture and just the fabric of the organization, the DNA of the company, and not something that you just did once, or even that you do once a year. It's just kind of, really valuing that and realizing how much of an impact that really makes on the business and the commercialization process.
100%. I can't emphasize that enough. And to be clear, sometimes I fall into the trap of not doing that. So it's not something that you got to keep referring to that internally and keep coming back to it as well. So,
and I think that goes back to your point where you have to have other team members that buy into this approach as well. So that way, when we start to veer off, that they can remind us, because it is really hard when you're in it. I mean, it's just such a knee-jerk reaction to like, I have a solution, let me go out and build it and deliver it, and without kind of slowing down to kind of do that investigative work or messaging something to where it's really all about you and how awesome you are, instead of what's in it for the target customer that you're trying to do business with.
I think it's so this is kind of a point where I feel. So I'm a PhD, candidate or graduate and so on. As an academic coming into the world, you sort of wonder, can I be a good salesperson? And like you see those flashy salespeople with, suits and driving out the Ferrari and all that stuff. Right. And you're like, that doesn't seem like me, right? At this point. So, but I think what was really a relief for me was to understand that sales is basically listening and trying to understand what the customer's problems are and to see if you can solve them. And at the end of the day, the dollar transaction is a way for both parties to make each other whole. But at the end of the day, it's about solving people's problems, right? And there's an art to a sale, which is making sure you uncover the problems and find the right people to buy into implementing your solution and so on. But it is about listening, and to me that was a huge relief, knowing that, because I can listen, I can always ask questions, I can be friendly, and I'm not very pushy, or I'm not trying to get people to buy cars, right? Like used cars. But I'm at the same time trying to just make sure that people are happy by working with us. And I think that was great, because it's just, I think for someone coming in from a technical background, I think it makes that's what I would say. Like, don't worry about, it's actually great that you have the technical background, because you can now solve the problem for people, solve complex problems for people. What you only need to do on top of that is to just listen to people and see how you can
right.
do that. So yeah.
Sounds like you've got it mastered.
It's always a work in progress for sure. I've seen some really great listeners, and I hope I can be like them someday as well.
This one time I actually took a whole class in my bachelor's degree on communication. I had a 12-week course on listening. Okay. And at the beginning I thought, oh my gosh, I mean, I'm like almost 30 years old. I've been listening my whole life. Why would I have to take 12 weeks of listening? And that course was a game changer for me, because I realized that I really sucked at listening. And I learned so much. I probably only apply 1/5 of that. Still have a long way to go. But I mean, it really, there is an art and really even a science to listening. Yeah.
Yeah. And I think it's the same even for our patients, right? With coaches that we offer. I think a lot of what our coaches do is, in the first week, just listen and try to see what the patient's lives are like. And I think that helps build trust too, because you're willing to say that I'm investing my time in just understanding you. And whether that's in sales or in working with patients, I think that pays off a lot in the long term, because it's about that investing in that relationship and not necessarily about solving the problem then and there as part of it. Yeah.
Yeah. Yeah. As a matter of fact, my professor at the time actually published a book called Listening Pays.
Okay.
the exact language that you just used.
I need to find that book on Amazon. I'll take a look.
Yeah. I'll send you the link afterwards. So as we kind of just start to wrap up here, I'd like to talk about where are you going next, right? What's in store for Moving Analytics in 2022? What are some of the things that you're really excited about? And maybe what are some of the challenges that you're planning on tackling in the upcoming year? As I've said before, our mission is to empower every individual to live a life free of cardiovascular disease. So I think to that end, we have a 10-year roadmap where we basically want to offer more and more therapies that cater to other indications, right? So a lot of what we're doing now is essentially trying to get more patients access to our core program, which is in post-heart attacks and post-surgeries. And so we are looking to work with more health plans to cover us, for more hospitals and doctors who refer their patients to us. We're spending a lot of time in the Midwest. So we work a lot in Pennsylvania and upstate New York and Illinois and everything in between. So just trying to grow a lot in that region and also expand to potentially other regions as well. So that's our short-term goal. But then eventually our goal is to expand to other indications. Things like cardio-oncology, patients with atrial fibrillation and other indications for whom rehab is currently not covered as a benefit. So by doing that, we want to essentially push the science and push medical knowledge further and really make that solid dent in the universe that we were always looking to make in the long term. So I think it's fantastic that you kind of have a vision for what's next, right? What's that next market or that next offer that you're going to be able to pursue after. But there's this strategy called a bowling pin strategy where, each one of those markets or each one of those products kind of represent a bowling pin. And most of the time when I'm talking to innovators, they get, it's like that shiny opportunity syndrome, right? And it's like they see all the bowling pins and, want to go after all the bowling pins at the same time or half of the bowling pins, right out of the gate. And what I really admire about what you're saying is that you're really focused. And because you're focused with your money, your time, and your attention, and all of the effort that your team is putting through, you're going to have a much more success with knocking down that first bowling pin that's going to help you get to the next bowling pin and so forth. But I think so many times we're just like, we're trying to spread ourselves too thin because we don't want to miss the window of opportunity for the other thing that we could pursue, that we end up not having enough oomph for the first pin and we end up not knocking anything over.
I think as an entrepreneur, it's very tempting to chase after the next shiny object. I think there was one quote from Johnny Ive from Apple that really resonated with me about focus, where he basically said, focus is where, you want to do something so badly with every fiber of your being, but you decide not to do it. Even though you really want to do it, and it requires a lot of discipline and a lot of self-control to get there. But I have learned that it's much better to be a very sharp knife than a blunt club when you're running a startup. So because then you can just move faster and be more efficient. And then eventually, like every company, you diversify and grow. It's a very large universe out there in terms of opportunities. And that is, I think, something that I keep trying to tell myself, and I would definitely encourage everyone to keep thinking about what is that focus point. What are the 10 customers you can make extremely happy and like rabid followers of you before you expand to the next 100 or 200 of them as well?
Oh my goodness. Okay, so let's just pause there for a second and kind of spend a little time with that as we wrap up, because that is also a real huge issue. Is sometimes we want to have 50 or 100 customers, right? So we can make these numbers and kind of, see this hockey stick, scale growth at scale. But then we don't none of those customers become raving fans or brand ambassadors, and we start to have issues with retention and attrition. And so I love what you're saying there is, pick that target list, that dream list, and really get focused on not only converting them, but then making sure that they do become those raving fans, because, that's so critical to crossing that chasm between that early adopter market and the mainstream market, is having those people that are telling their peers about your solution and really start to have that word of mouth momentum that is so important.
Yeah, I can't emphasize that enough. And I think, when we've learned that when you make your customers extremely happy and raving fans of yours, they do your marketing for you. It's like the most cost-effective marketing budget. So, we should definitely focus on that aspect. And then there will be a time where you will have to shift gears to leverage that initial tip of the iceberg to go to the entire iceberg as well.
Yeah, but I'm definitely not saying that the business strategy should be 10 customers and that's it.
Unless all 10 were NASA, so then
right, exactly.
But I can't emphasize that enough, I would say.
So is there anything else that you would want to share with our audience before we wrap up?
I think it's really just, I want to emphasize our mission, which is, we want to serve at least like 1 million patients every year, right? So, and for the audience who's interested in working with us, if you feel your talents could help us in achieving that mission, there's this fun fact I like to say, which is a patient who does cardiovascular rehab doubles their chance of living another 5 years. And there are about 2 million adults in the US every year who don't get that chance. So we have the opportunity to give back essentially 10 million years of life to humanity per year. And what does that really mean, in terms of the birthdays, the anniversaries, time spent with your loved ones. And we really want people to help us in that mission. And if there's any way you can contribute, an intro, or if you want to join our company, if you want to cover us as a benefit, we'd love to work with you and make this mission a reality as well.
That's awesome. So how do people get a hold of you if they want to connect with you after?
You could just send an email to hello@movinganalytics.com or contact us on Twitter @movinganalytics, or message me via LinkedIn or via Twitter as well @Vathsangam. Yeah.
Perfect. Thank you so much for joining me today.
My pleasure. And it's a great conversation. I hope the audience really loves it.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.